get started with Otomagnetics. It's my pleasure to introduce Vita Batra from Otomagnetics. Disclosure, I invested in Otomagnetics. I won't be voting in the poll, but she's a great speaker. I think you'll enjoy her talk, and just another great company to come and talk to us today. So thank you, Abida. You can go ahead and get started whenever you are ready.
All right.
You got 10 minutes.
Thank you guys for being here and giving me the opportunity to talk to you. Otomagnetics is a unique company. I come from a pharma background, so this has been amazing for me. I mean, we all know that we spend like billions of dollars getting a product to the market, but the issue is that the drugs that we are getting approved through FDA, they're not reaching the target indication in the right amount of time and in the right dosage. And we, of course, have a lot of side effects through those drugs. So this is where I am talking about Otomagnetics and the value proposition it offers. So not sure if you can see my screen, but yeah, all right. So the major issue is that the traditional drug delivery is invasive and ineffective for hard to reach target indications. There are surgeries and needles that are being used unnecessarily, and that's where we think we as Otomagnetics could change that. Currently, surgeries are being used for middle ear infections and inner ear treatments. And one more market that you guys might be aware of is macular degeneration, where the only treatment is using needles, and that's how the antibiotics are delivered to the eye. So yeah, these treatments could be completely eliminated if we offer Otomagnetics technology, and that's why we are here. So this is the Otomagnetics solution. We are offering a non-invasive, or I should say minimally invasive treatment where we have a magnetic drug delivery platform. We have a device that creates the magnetic fields and force strengths to deliver the drugs to the target indication. We're using a magnetic nanoparticle basically that has an ion core that gives the magnetic property to the drug, which basically gets delivered with the magnetic forces. I have an explainer video. I mean, if you want, you can look at it. I can send you the link. It's a 2-minute video. Really nice to watch, and you can even watch it on our website. But just to save time, I'm going to just talk about the device that we've created. There's a prototype that has been developed and designed by us in collaboration with a team. This is the picture of it. It is in the form of a cart, which has a 400-pound magnet embedded in it. There is a pillow on top with 2 sides for the treatment of each ear. One is the left ear and the other is the right ear. And the kid lies down on it. And we basically pull a bed out of this cart and strap the kid before the treatment is started. We as a company are targeting 2 programs in-house. One is the inner ear program and the other is the middle ear program. I'll talk a little bit more about it. And yeah, let's talk about the target indications. As I said, we are focusing on ear in-house. One is the middle ear infection. You might know about it through just as otitis media, and the other is the ototoxicity that is being caused during the chemotherapy regimen. We all are aware of the fact that hair loss, nausea, and vomiting are the side effects for chemo, but not many people are aware of the fact that hearing loss is also a side effect, primarily because there is a hair cell line inside the ear which is responsible for hearing. If the drugs are given systemically during chemo, that would interfere in the treatment of cancer. Hence, if a kid is given that option, do you want to live or do you want to save your hearing? What are they going to choose? Of course, they're going to choose to live, right, and survive, and that's what a parent wants. But if we give the technology and an option like us, of course, we can save the hearing by providing a localized targeted drug delivery treatment. So we have these programs in-house to save the hearing for chemo patients and otitis media, where multiple middle ear infections lead to transtympanic surgery. And we believe that if we can provide our treatment, a general anesthesia would be eliminated, and so the surgery where we can deliver the drugs non-invasively to the kid and treat the infection and the inflammation. The other indications are, that we would explore our eye and skin. In eye, we would explore macular degeneration. In skin, there is a huge market in derma where we would be looking at transdermal vaccines as well as diabetic ulcers. So these are sizable markets. In year, recent statistics says that between 2019 and 2022, the year space is around $2.3 billion. If you just look at otitis media, and if you just capture 5% of the market, it's going to be around $240 million, which is not bad. For the first few years for us. And the chemo market, where ototoxicity causes the hearing loss, that's around the same number. There are around 700,000 patients for otitis media every year, according to Action on Hearing Loss, and 700,000 patients for kids who suffer from hearing loss after cancer treatment. And the other indications you are aware of is, eye has a huge market with $3 billion, and skin has even a bigger market, which is $16 billion, being the biggest organ of the body. So yeah, of course I'm talking, but I have to show you the results, right? Then you'll believe me what I'm doing. So this slide basically talks about the targeted magnetic delivery that basically prevents the cell damage in animals. These images talk about the inner ear treatment that we are providing. If you look at the rightmost image, that actually shows our magnetic particles are going through, and the green color of the fluorescence shows that we are able to recover the hair cell line. And yeah, it's a targeted treatment that can prevent hearing loss after chemotherapy. And this slide shows how efficacious our treatment is in otitis media. We can clearly show the delivery is happening with our treatment, and it's much more than the non-magnetic delivery that happens. And on the right side, you can basically show the images, how we are able to figure out that the delivery is happening because of the color. And then we, of course, measure the drugs that go in, and statistically, or I should say quantitatively, mention all that is happening, along with the ABR equipment that we use to show that the hearing is retained. We have a robust and defensible IP strategy. We have over 60 patents now issued in US, Europe, and Japan. We do have worldwide and exclusive license for magnetic injection of any drug to any target. We do have freedom to operate, and we've reviewed over 200 patents. So yeah, we've established a strategic regulatory plan with our advisor, King Lee. He's done over 90 IND filings, and our technology component has been FDA approved for other indications, hence everything is GRAS. We just submitted our pre-IND package, and we have a meeting with FDA on 19th of January. So we intend to have an accelerated FDA pathway. We will be doing our phase 1 this year, and then we'll accelerate to phase 3. We do have a proven team. I am the CEO. I'm a co-owner of a generic company which has 150 generic products on the market. Ben is known and recognized world leader in magnetic drug targeting. Julio is actually the founder, and he's the founder of Cytomune, which actually worked with gold nanoparticles. And we have Mohammed, who's the director of formulations, who's developing everything with us. We are supported by an expert advisory team. Chip is the guy who actually branded ciprofloxacin in US. He's on our board, and he actually is working with us to source the APIs, which is one of the components that we are using. We've loaded actually over 20 to 30 products on our magnetic nanoparticles, from genes to proteins to any sort of drugs or payload that you can think of. Jerry has been immensely helpful in the company. He has taken 3 FDA approved, or I should say, he's taken 3 magnetic nanoparticles through FDA approval. One is Peraheme, which is used for the treatment of anemia, Feridex, and Gastromark. Eric is great. He has been very helpful in putting together a pre-IND package. He's been involved in 2 FDA hearing studies, and King, I already mentioned to you, and Tony is an ex-CCO of Autonomy in hearing space, and he's helped us design the reimbursement strategy. These are our esteemed partners. Frontage is a partner for CGMP manufacturing of our formulation. Louis Presboy is our IP attorney. IO is our team for device. Excella is for Excella is our CRO. Silcare has helped us do research in ABR studies, and Dwayne Morris is our legal firm, and SCH is our accounting firm. So yeah, I mean, these are the financial projections. I can obviously get into more details, but we intend to have some revenue in 2022. In 2023 will be over $100 million in revenue. And I can share COGS and all the details with you guys, but we do have a magnetic nanoparticle that is, basically costing us $100 to be manufactured, which will be sold for around $5,000. So there's a huge revenue.
Hey, sorry, Bita, I was waiting for you to take a breath, but you hit your 10 minutes.
Okay,
so we
right.
have to open this up for judges. Thank you for your great presentation. And Lubna, I see you want to ask a question. Why don't you go ahead and throw that into the
Sure.
chat? We'll either bring you
I
on,
already had,
we'll
I put it in the chat, sorry.
Oh, okay. Great. I'll look for that. Go ahead. Judges, do we have any questions? Well, let's start with Lubna's question then. Have you studied tympanostomy tubes versus medication with this device?
Right. So tympanostic, I should say tube surgery is a major surgery I want to mention, where kids are given anesthesia, general anesthesia, before the surgery is being done. And there are times when tubes fall out and the surgery needs to be done again. So yeah, I mean, we haven't compared it per se, but we are actually working and comparing ourselves to Otowell, that is given after the tube is, tube surgery is done and tube is put in. So we are comparing ourselves to Otowell.
Okay. Any other questions from our judges, or the audience is welcome to post some questions here.
Hey, Warren.
Yeah.
This is
Hey,
Chris.
What do you got?
So you didn't quite get to it, but strategic partnerships?
Yeah, that's a good question. So we have great partners in play right now. Cochlear is the biggest company in the world that actually does cochlear implants. So they are partnering with us. We'll be initiating a project with them this year. Actually, they wanted to do it last year. We were busy with our pre-IND. And Mitsubishi is another company. So Mitsubishi Holdings, Mitsubishi Pharma, and Mitsubishi Ventures are in play, and we'll be partnering with them as well. So we visited Japan. They visited us multiple times, and so has Cochlear from their Belgium team and Australian team. So we'll be partnering with these two. But we have multiple other companies that we are going to be partnering with. One of them is a prostate cancer company. We've already initiated work with them. I keep repeating myself, but we're not a competitor to any pharma biotech. We are a collaborator, so the opportunities are huge here.
Okay. Hey, Bita, one of our audience members, Brett Smith, says 3 prior magnetically delivered drugs were all iron-based. What iron-based medications are relevant to the ear eye? I think he didn't quite pick up the nanoparticles that have the iron oxide, but then get other medications. Maybe you can take a very brief moment to explain that, because we have a minute and a half left.
Okay, all right. So nanoparticles, I'll explain how it looks like. The core of it is iron oxide. Around that, we have a polymer, and that has these pockets in which the drug or the payload goes in, which all together look like a tennis ball, and that's our formulation. This formulation is around 100, 120 nanometer, and it's given in the form of a dropper to the patient that lies down on that cart, and then the magic happens with that cart. That's how it looks like. So ferraheme is actually iron oxide, but we are using very low quantities of iron oxide compared to what ferraheme is. So the comparison is, if ferraheme can be delivered and used, the toxicity profile doesn't exist for the iron oxide that we're using.
I have a question, if you don't mind.
Yeah, please go ahead.
Sure, Zvi, what do you got?
My question is why you are considered a startup?
We are a startup.
You have so much money. You're not a startup.
We are a startup because we.
Oh, know what I know startup. I started 10 companies.
Okay.
I know what is a startup.
You're muted, Zvi. Let her answer.
Yeah,
Go ahead.
we've raised more of the non-dilutive funds through SBIR, NIH, and we were supported more from them. We just started raising money from the private market, and we have raised around $3 million. So I think the opportunity is huge, right? If you want to invest, please give me a call.
Okay, that is our time. Beta, thank you so much for that presentation. We're going to go ahead and here's the poll. The polls are now open. People vote away. And while we do that, our next presenter is Trent Jeffries from VendRx. So he's going to get on deck and we'll collect some data here. Okay. Half a minute left in our timing.
For some reason, I don't see the poll. Lauren.
Uli, did everybody get this? We have 45 answers.
Got it.
Maybe
Got
click
it.
on
Sorry.
polling at the bottom. That's okay. Okay, 3 seconds. Okay, and just as a courtesy to the presenters, I will ask everybody to please be on mute while they're presenting. I'm just writing down the results and we'll move on. Okay, great job, everybody. Thank you so much, Beta. And we're